Hi guys, and welcome to the latest podcast for the Citizen Chat. And as you can see, I'm joined by two new guests this month, and I'm just wondering, firstly, can you tell us who you are and just an interesting fact about you both, if that's okay? Pete, are you happy to go with yourself first?
Yeah, I'm Pete, and I like going on public transport, and I travel up and down the country doing my hobbies.
Oh, that's great. And what about yourself, Charlotte?
I'm Charlotte, and I quite like making things, like doing crafts, and at the minute I'm kind of into crocheting little animals and weird food stuff.
That's great. Thank you for that. So obviously, I know that you work at Midland Mencap, don't you, Charlotte? And I was just wondering, first of all, can you tell me a bit about the Wellbeing service, please?
Okay, so the Wellbeing service itself is relatively new, and it's only been around for sort of 6 months, but it's an extension of what used to be the Supporting People service, which had been around for quite a few years. So we're funded by the council. We can provide up to 4 hours a week to adults with a learning disability across the city. We're essentially a prevention service. Now, what that means simply is that we help people to prevent homelessness, prevent financial concerns and debts, prevent health issues and needing higher cost services in hospitals and care and things like that, and just preventing isolation, getting out and about, meeting new people.
Mm-hmm. And if someone was to come and use the Wellbeing service, in what sort of ways would that service help them?
Okay, so some of the stuff that we do and we can do, so in regards to finances, we do a lot around benefits support, so helping people check what benefits they're maybe eligible for if they're not in receipt of any, doing, budget plans, helping them apply for benefits such as PIP, Universal Credit, ESA, dealing with all the forms, the paperwork, getting the evidence, any tribunals that might come up, which do come up quite a lot. We help along, a lot in the process of that. In regards to health appointments, some people might struggle with understanding information that's given to them. They might want help to go to hospital appointments, GP appointments, things like that, or just don't really engage with it. So they might just somebody to prompt and say, come on, we need to go to these appointments, getting the health checks, the annual health checks especially, up just to prevent any, bigger health problems. Housing is a big one. So a lot of the citizens we support live in Birmingham City Council properties and other providers' services. It could be that where they're living currently is either not up to scratch. It might need a lot of repairs. I mean, there's a lot of talk at the minute of a lot of homes with mould and damp in them, and we do come across that quite a lot. They might be struggling with how they're supposed to fix those issues, so we can help them get started, arranging the repairs with people, getting them, up to something a bit more livable, as well as if they're wanting to move, we help sign them up to all the services across the council and any other providers, bidding on properties, filling in the paperwork, all that kind of stuff. Reducing the isolation, we help people access other services, clubs, look at what their hobbies are, what might be available in their local area, getting them out and about, even just coffee mornings, college if they want to. We work closely with the Pure Project, so they obviously help us with any college courses they might be on, or getting them intensive support around employment if it's a job that they're after, or volunteering in charity shops, or just something to get them out back into the community, meeting some new people. Those little things just kind of help with mental health and everything. Back into being healthy, as well as like the appointments and getting them to all the checks that they need to do. It could just be as simple as joining a gym, helping with looking at healthier food options to help with, if they're weight loss, or they're not necessarily, they need to do some things for if they've had a hospital appointment and they've been told, okay, you need to maybe lose a bit of weight, or you need to change some things about your diet. It could be as simple as looking at food choices in the supermarket, help with a bit of shopping and healthy items, or even meal prep if, they struggle with cooking and then, they not necessarily great at cooking big meals. We can help with meal prep, maybe do some bulk cooking. So rather than eating takeaways or microwavable meals during the week, it can be a case of they've made something, they've frozen it, and they can just get that out and pop it in. Simple things like this, just the daily living skills that we kind of take for granted sometimes that you do yourself. Just remaining as independent as possible in the home.
Yeah, so that sounds like it's quite a lot for your team to do. So what's your role within that team?
So I'm the service manager of the community wellbeing service.
And what sort of things do you do within your role, if you don't mind me asking?
No, it's fine. So obviously I'm the service manager. I manage a team of 5 area coordinators that cover Birmingham, and each one of those coordinators in turn has about 10 to 15 members of staff under them that do the frontline support. So my job is to support the coordinators and the wider team to be able to provide the support they need. So there's all the HR, looking into what's available around the city as well, and advertising things. It can be a lot of the boring office stuff as well, payroll and all those other things that need doing. But it's more about just supporting the coordinators to then support the staff and the citizens as well, going out and doing those visits myself sometimes if needed alongside the coordinators, and just making sure everybody gets what they need.
Okay. And Pete, I'm going to ask you a few questions now because I feel like I've grilled Charlotte enough. How long have you been using the Wellbeing service, if you don't mind me asking?
Since 2017.
2017. And I know that we've had a 5-minute talk just as we were getting ready to record this podcast today. You said that you referred yourself, didn't you?
Yeah.
With that. And how long have you actually been using all of Midland Mencap services?
It's, like 6 years now, I think.
Yeah.
Got about 6 years.
Said about 2010, didn't you?
I started, I got referred by Shell Force in 2010.
Yeah.
But I was looking for housing then, and then it dropped off the scale, and then I came back to Mencap in 2017. 7 years. There was like a 7-year gap.
Yeah. So obviously you've been using the Wellbeing service since 2017.
Yeah.
And can you tell me a bit about what life was like before you started using the service?
Really bad.
Just difficult.
Really bad. Yeah.
Yeah.
Like you got people coming home at 2:45 in the morning, waking you up, getting disturbed sleep, and that was my life.
Yeah.
Having no proper life at all.
Yeah, okay. And can you tell me in what ways has the Wellbeing service helped you?
Yeah, because you get your support. Every week, say for about 2 hours or 4 hours, and then they come and check and see if you're okay. And so, like she said, like Charlotte said, they do take you to the like appointments and stuff like that. And you can go out and do like park and ride sessions. You can do anything with Mencap, like join the what I can't say. The club thing, what you got.
Yeah, so we've got the hub, haven't we?
Yeah, we've got the hub, and we can do quite a lot of different things, like your arts and craft, and you've got arts and craft park ride, and swimming on a Friday.
Yeah, you do that in Walsall, don't you?
Yeah, and you got the Walsall hub. That's good as well for me, because I've met people at the Walsall hub, and there's still now. I try and support James as well. He's got a learning disability, but he's come out of his shell since I've been there. Talks to me. It's good as gold.
And I know that we were saying as well, because you've actually reconnected with
quite a lot of people. Yeah, because there was a training centre in Eachels in training centre 1993 to 1996, and I met people, and then they disappeared. And now since I came back to Mencap, I met the same people after all this time.
Mm-hmm. And if someone listening to this podcast today, Pete, was thinking, oh my God, I really could do with help like that, like what Pete's getting, but I'm really unsure about getting in touch, what advice would you give?
Phone the office up and see what sort of support you can get.
And is it safe to say no one within the Wellbeing team is scary?
Nah.
No, they're all quite nice.
Everybody's, all the team, they've got really, really, really friendly. They're really good.
That's good.
I can't say it properly, supportive.
supportive and everything. That's great. Thank you, Pete. And just a few questions for you, Charlotte, as well, to pick on you again. Who would actually qualify to actually use the service?
So the criteria we have, so you have to live within the Birmingham City Council area. So that's the only place we support. But you also have to have a diagnosed learning disability. That's the criteria.
And have you got any examples of any citizens that you've managed to really help using the service?
Yeah, I mean, we've got quite a few. So picking on one, obviously won't say any names, but we were supporting a gentleman. He was living in a Birmingham City Council property. It was really bad disrepair, mould, damp, holes in the walls. It was not in a good condition when we came on board. Obviously, he was really anxious and a bit not comfortable living where he was. So the staff started by trying to, improve that, getting the repairs done, getting all the things fixed, all the damp sorted and everything with the council. But whilst also then signing him up to, the bidding services to try and get him moved because he wanted out of where he was. He just needed a fresh start. Eventually, they managed to get him into an over 55s property, which was great, sort of in the same area because that's where he knew his family were. Moved him in, helped him make it his own, get new carpets, white goods, fridge freezers for the kitchen, things like that. Anything he need. They were applying for grants because he had a low income, so they managed to get certain grants that would give him, help him fund these purchases. When we met him, he was only in receipt of universal credit, so it was, very little income. He wasn't working, that's all he used to get. So we obviously applied for PIP for him as well, got that awarded. So he's now, we've maximised his income, he's got, what he's eligible for. So he's got more money generally, so he's able to live a better life. He was just feeling so much, he had the anxiety before about where he was, but he's just so much more comfortable and so much more happy where he is now that he loves being in his house and having people around, and it's just made such a difference.
That's great, and that's obviously testament to how good the team at the Wellbeing service.
Yeah, the frontline staff are fantastic.
Amazing. Yeah. Did you want to say something, Pete?
They do come out for you, and they got what they said about when you went for the tribunals and that, and I won mine.
Yeah.
They came to mine. Karen came for mine, and I won mine.
Yeah.
And they do come for appointments with you if you need it, and they got somebody like spare. They will come out. And if you got issues with the doctors and stuff, they'll follow that up as well, and they'll what's the name as well, make complaints for you. They'll do anything within reason for you.
Yeah.
Mencap.
And I think that's really important things, isn't it? Because actually when you need someone to fight your corner.
Barriers, you say. I find that there's barriers, and there's certain barriers, and you have to overcome that. And then once you come over that fear, then you're all right.
Yeah.
I've had that.
I think that's the biggest thing, isn't it? Having someone that's fighting your corner when we're not necessarily able to. As I say, we've spoken before, haven't we, Pete? I've got a disability myself, and it's one of those things. Whilst I'm more than capable at doing some things, there are other things that I do need a lot of help with. And it makes all the difference when you have a really good support system behind you, making sure that you are going to get all the support that you need to be able to have a really meaningful life. That's the most important thing, isn't it? And I suppose, obviously, Pete had mentioned he'd referred himself to the Wellbeing service back in 2017. What different ways can someone be referred to the service, Charlotte?
In any way, so we get them from social. If you've got a social worker involved, they can refer. We'll have to get emails. They have the referral forms usually on file because they've dealt with us before. We get a lot of social prescribers from the GPs, can ring up or email, send it through, as well as doing it yourself. I mean, if you're unsure of what you might be able to get or whether you're eligible, you can give the office a call, have a chat with one of the team. Always here to sort of chat, and if we can even fill the referral form in with you over the phone. If you're not so good with your writing or reading forms, we can just do it there and then, or we post it out to you or email it to you to complete. There's so many ways. There's no right or wrong way, really. Just get in touch is the main thing and talk to somebody.
That's great. And I suppose the last question from me, for you, Charlotte, is if I had to ask you to sum up the service in 3 words, what 3 words would you give it?
I'd say, so non-judgmental, I think, is the main one. There's no judgment, empathetic to sort of everybody, reliable, that we will be there every week, on the end of the phone if you need it. Just friendly, I think, is the other one. Friendly. We are a friend. We're not gonna, dismiss you. We'll try and help anybody that we can.
Yeah, that's great, because as I say, it is really important that people know that there are support out there to be able to get the help that they do really need to be able to live as independently as possible.
It's just been on the end of the phone sometimes, isn't it?
Yeah.
Sometimes ring up and you just not need to speak to somebody for a little bit.
Sometimes you want to talk to somebody and you want to chat with people. So if you've had a right bad day or something, you just need somebody to talk to. Just pick the phone up and they're there for you.
That's absolutely fantastic. Well, thank you both for taking the time to speak with me today. If anyone, after watching this podcast today, has any questions for the Wellbeing Service team, you can comment in and let us know, and we can always forward it to the Wellbeing Service. See you later.
Bye.
Bye.